Thank you for joining us for today's presentation, ERS Benefits Overview, presented by the Employees Retirement System of Texas, or ERS. ERS is a state agency located in Austin, Texas. We manage the retirement and insurance benefits for state of Texas agencies. We also manage the insurance benefits for some higher education institutions. This presentation is to provide information on the Texas Employees Group Benefits Program, GBP for short, and review the state of Texas retirement benefits. The topics we'll cover today include your state employees benefits package and the insurance options available in the GBP and your ERS retirement benefits. These include the state's mandatory defined benefit or pension plan and the voluntary Texas Saver 401k or 457 savings program. We'll also talk about designating beneficiaries and direct you to resources where you can find more information. New employees, throughout the presentation, I'll refer to your New Employee Benefits Guide, or NEBG, which has detailed information about the topics we'll discuss today, as well as health and prescription drug plan comparison charts and monthly premiums for each plan. Pictured here is the NEBG for state employees contributing to the ERS retirement plan, Brown, and the NEBG for employees who work for an agency or a higher education institution that participates in the GBP but contributes to a different retirement system, Green. Please follow along in the NEBG that applies to you. The page numbers for each reference topic is at the bottom of the presentation slides. All page numbers in green apply to both NEBGs. The state of Texas offers a comprehensive employee benefits package. Currently, the average compensation for state employees is $78,146. Now, you may think, I'm not making $78,000 a year, but when we look at your state employees benefits package as a whole, the average employee receives a salary and benefits that equal that amount. Let's take a closer look at what this amount represents. We see in this chart that 64.7% of your total compensation is your salary. Health insurance makes up 11.5%. This is because the state pays 100% of the health insurance premiums for full-time employees. Currently, that's a benefit of $622.60 per month. The state also pays 50% of your eligible dependents' health insurance premium. That's a really big benefit to working for the state. Contributions to your ERS retirement plan make up 6.5%. We'll talk more about retirement benefits later in the presentation. Vacation, holidays, and sick leave represents 10.5% of your compensation, and things like payroll expenses and longevity pay account for 6.8%. Now that we've discussed your total compensation package, let's look at your benefits options. As a state of Texas agency or higher education institution employee, you participate in the Texas Employees Group Benefits Program, or GBP. When you're hired as a full-time employee, you're automatically enrolled in Health Select of Texas, a comprehensive medical insurance plan administered by Blue Cross and Blue Shield of Texas, which includes prescription drug coverage and $5,000 basic term life insurance. You and your eligible dependents have other benefit options, including dental and vision insurance, optional and dependent term life insurance, voluntary accidental death and dismemberment, or AD&D, short-term and long-term disability insurance, and TexFlex flexible spending accounts. We'll discuss each of these benefits in more detail in the next few slides. You can find the complete list on page 4 of the NEBG. If you're a new employee, you'll want to be aware of certain dates and deadlines for enrolling in the benefits we discussed today. Let's start with optional add-on benefits. Now, what are those optional benefits again? Those optional benefits include dental, vision, and life insurance, short-term and long-term disability insurance, and TexFlex. Within your first 31 days of hire, you can enroll in health and optional add-on benefits with the exception of certain TexFlex flexible spending accounts, or FSAs. You can enroll in TIP, short-term and long-term disability insurance, optional term life insurance at 1 or 2 times your annual salary, and or dependent term life insurance without going through evidence of insurability, or EOI. This makes your first 31 days of employment a great time to enroll in these insurance plans. We'll talk more about EOI later. You can also add or drop eligible dependents from coverage. If you're enrolling an eligible dependent in any coverage, you must complete the dependent child certification. There's more to come on certifying your child for coverage. Full-time employees are automatically enrolled in Health Selective Texas U-only coverage. If you're a part-time employee, you need to take steps to enroll in health coverage. The state pays 100% of the monthly health premium for eligible full-time employees and 50% for their dependents. The state pays 50% of the health premium for eligible part-time employees and 25% for their eligible dependents. If you're subject to a health insurance waiting period within your first 60 days of hire, you can enroll or change your health insurance. All new hires or rehires who are subject to a health insurance waiting period must wait to enroll in a TexFlex healthcare or limited purpose FSA if you choose to enroll in one. Here's an example. So maybe you have health insurance somewhere else, such as maybe your spouse or through TRICARE if you're ex-military, and you don't need health insurance through the GBP. You can waive your coverage, but you must do that within the first 60 days. You can add or drop dependents during your first 60 days as well. If you're adding your children to any insurance, you'll have to complete the dependent child certification. If you're adding your children and or your spouse to health insurance, you'll have to complete the dependent eligibility verification process. We'll talk about these processes in a few minutes. If you enroll in a GBP health insurance plan, you must certify yourself and any covered dependent as tobacco users or non-users. Texas law authorizes ERS to charge a premium to any person enrolled in a GBP health plan who uses tobacco products, including e-cigarettes and any vaping products. You need to certify your status only once unless your tobacco use status changes. After your first 31 or 60 days of employment, you can only make benefit changes or enroll eligible dependents in any coverage only during summer enrollment unless you have a qualifying life event or QLE. For a list of eligible dependents, check out the ERS website or the dependent eligibility chart in the New Employees Benefits Guide. You can also enroll eligible dependents in the following plans if you're enrolled in them yourself: health insurance, one of two dental insurance plans, State of Texas Vision, dependent term life insurance, and voluntary AD&D insurance, U plus family. Regardless of whether you add a new dependent through summer enrollment or a QLE, there are certain certification and eligibility verification processes you'll need to complete when enrolling them in your benefits. You'll certify and verify your dependent's eligibility through the Dependent Child Certification, which is completed online at the time of enrollment, and Dependent Eligibility Verification process if adding your dependents to health insurance. You must complete this shortly after enrollment. Enrolling dependent children in any GBP coverage requires you to certify that the child is eligible for benefits. The Dependent Child Certification is part of the online enrollment process where you tell ERS your relationship to them. It must be completed before the enrollment can be finalized. The Dependent Eligibility Verification is part of an audit performed on all dependents enrolled in health insurance. ERS works with Alight Solutions, our third-party administrator, to verify that dependents are eligible to participate in GBP plans. Once you enroll a dependent in health insurance, Alight Solutions will send a letter outlining the steps of the verification process, the names of the dependents needing verification, the type of documents you need to provide for the verification, such as a marriage certificate or birth certificate, and the due date to submit the documentation. It's important, if you get a letter from Alight Solutions, open that right away. Be sure to carefully review all the information and keep that deadline in mind. You must comply or your dependents will be dropped from all coverage. If a dependent is found ineligible, ERS will remove him or her from all GBP coverage. Documentation proving your dependent's eligibility must be dated prior to the date you enroll them in health coverage. For example, Jane adds a common law spouse during summer enrollment. The documentation she'll need to verify a common law spouse is a declaration of informal marriage filed with the county courthouse and either a current federal tax return filing as married or proof of joint ownership issued within the last 6 months. Her documentation must be dated prior to when she added them to benefits. If she cannot provide proof that the relationship existed before she added them to coverage, the dependent will be dropped from coverage. ERS implemented these requirements to ensure that all dependents enrolled in GBP are eligible. The cost of healthcare can be expensive. Paying out claims for ineligible dependents costs you and the state of Texas money. So verifying dependent eligibility prevents fraud and keeps expenses down for the state and members like you. Please note, if you're adding dependents who previously were approved through the dependent eligibility verification process, you will not have to verify them again. If you have dependents who were not verified before because you missed the dependent eligibility verification deadline or you could not provide the needed documents, you can add them during summer enrollment or a QLE. To do so, you must submit documentation to ERS, not a light, to prove your dependent's eligibility. Dependent children are eligible under age 26 for health insurance and can be married or unmarried. Children must be under age 26 and unmarried for dental, vision, and dependent term life insurance. Disabled dependent children age 26 and over may be eligible for insurance. For more information, you can review page 6 in the NEBG. If you're beyond the 31 days or 60 days of your hire, it's important to understand that due to IRS guidelines, you're limited to when you can make changes to your benefits. You have 2 opportunities to make changes to your benefits throughout the year: during summer enrollment, or if you and or your eligible dependents experience a qualifying life event, or QLE, that allows you to make a change. The most common QLEs include marriage, divorce, birth or adoption, employment status change for you or a dependent, significant change in cost or coverage for non-GBP health, vision, or dental coverage, or cost of daycare and leave of absence or return from leave. You have 31 days, including the QLE event date, to enroll in or make changes to your benefits. Summer enrollment is the one time of year you can make changes without experiencing a QLE. Summer enrollment is typically held in June and July, with elected changes effective September 1st. You can make changes to your Texas Saver account at any time. You can also update your beneficiaries for your life insurance and ERS retirement at any time. So when does your health coverage begin? If you're subject to a health insurance waiting period as a new employee or a rehired employee with a break in coverage, you have a 60-day waiting period before your health and prescription drug coverage begins. Your coverage will begin on the 1st of the month following your 60th day of employment. If the 60th day of employment falls on the 1st of the month, your health coverage will begin that day. For example, if you were hired January 13th, your 60th day of employment is in mid-March. Your health coverage effective date is April 1st. If you were hired on January 2nd, your 60th day of employment is on March 1st. So your health coverage is effective March 1st. If you enroll in optional add-on benefits on the first day of your employment, the coverage will be effective right away. If you make changes or enroll within 31 days of your hire date, the coverage begins the first of the following month. As a reminder, the health coverage waiting period does not apply when you're a rehire who has not had a break in coverage, you transferred from the University of Texas or Texas A&M University without a break in coverage, or you're currently enrolled in GBP health coverage as a COBRA participant on the date of hire or rehire. If one of these situations applies to you, contact your benefits coordinator for more information. Now that we've discussed who can enroll and when, let's take a closer look at your health insurance options. All full-time employees enrolled in the GBP health insurance plan also receive a $5,000 basic group term life insurance coverage at no additional cost. You can look at pages 7 and 8 of your NEBG to review your health care options. Let's take a look at your health insurance options. We'll start with Health Select of Texas. Health Select of Texas is a point-of-service plan available to employees and their dependents living in Texas. A point-of-service plan simply means that what you pay for medical expenses is determined by where you receive the service. If you stick to in-network providers, you're going to pay less. The plan has a large statewide provider network. In the Health Selective Texas plan, you must designate a primary care provider, or PCP. With some exceptions, such as OBGYN care or mental health services, you will need a referral from your PCP if you want to see a specialty physician. You're not limited to seeing in-network providers, but you will pay more for out-of-network services. When using in-network providers, you do not have to meet an annual deductible, which is the amount that's paid out of pocket before the plan starts paying towards covered medical services. You will pay a copay and/or coinsurance, or your out-of-pocket costs, for most covered medical services. The plan covers 100% of in-network preventative care when coded as preventative by the provider. The plan includes prescription drug coverage administered by Optum Rx. The prescription drug plan has a $50 annual deductible that resets on January 1st each year. You will receive a prescription plan ID card that is separate from your medical plan ID card. You can find more information on prescription drug benefits on page 13 of your NEBG. Consumer-Directed Health Select, administered by Blue Cross and Blue Shield of Texas, is available in the Texas service area and is made up of two parts: a high-deductible health plan and a health savings account, or HSA. You have access to the large Health Select provider network, and you'll pay less out of pocket if you see in-network providers. The high-deductible plan features include no PCP or referrals required, a coinsurance applies after the deductible is met, and in-network preventative services are covered at 100%. Consumer-Directed Health Select also includes prescription drug benefits. Employees who are enrolled in Consumer-Directed Health Select will be responsible for paying all covered health expenses and prescription drug costs out of pocket until the deductible is met. Prescription drug expenses are included in the annual deductible. The annual in-network deductible is $2,100 for individuals and $4,200 per family. As in Health Select of Texas, in-network preventative services are covered at 100% even before the deductible is met. Once the deductible is met, the plan pays 80% towards covered in-network medical services and prescription drugs, and a 20% coinsurance will apply. The 20% is the amount that you'll pay out of pocket. Now you may be asking yourself, what is the benefit to enrolling in Consumer-Directed Health Select? Well, the primary benefit is the opportunity to save money tax-free in a health savings account, or HSA, and get money from the state of Texas deposited into the account each month. The HSA helps you put aside pre-tax money from your monthly paycheck so you're prepared for out-of-pocket healthcare expenses, and it can be used towards meeting the deductible. The funds are deposited into an account with Optum Bank, which is the HSA third-party administrator. You can use this account towards eligible medical and prescription drug expenses, and it will lower your taxable income. The state will make a monthly contribution of $45 per individual and $90 per family. You can also make your own additional tax-free contributions into the HSA up to a maximum set by the IRS. Some benefits to enrolling in an HSA include the balance carries over from one year to the next. You keep the funds even if you switch health plans or leave state employment. Funds can be used towards qualified medical expenses for yourself and your eligible dependents. And once $2,000 is accumulated in the account, the funds can be invested. If you enroll in this plan, it's important to take action and open your HSA with Optum Bank as soon as possible. Please note, ERS and your benefits coordinator cannot open your HSA for you. More information about this plan can be found on pages 10 through 12 of the NEBG. Both Health Select of Texas and Consumer-Directed Health Select are network-based plans. That means you'll pay less out of pocket, possibly a lot less, if you see providers in the Health Select network. You should use in-network providers and get the appropriate referrals when necessary to keep your out-of-pocket costs as low as possible. The Health Select network includes tens of thousands of providers, PCPs, specialists, mental health care professionals, hospitals, and other facilities throughout Texas. We recommend that you review the health plan comparison chart to learn about your out-of-pocket costs for various types of service. The chart is available on page 15 of the NEBG and on the ERS website. It's a great resource. You may want to make it a practice to look at the chart before you get a covered service so you know how much you might have to pay out of pocket. If you're already enrolled in health coverage that's as good as or better than what the state provides, excluding Medicare, you may want to consider the health insurance opt-out credit. If you elect the opt-out credit, you waive your health coverage, prescription drug coverage, and basic term life insurance. In exchange, you'll receive a credit for up to $60 for full-time employees and $30 for part-time employees that you can apply towards your vision, dental, and/or voluntary AD&D insurance. If you do not use the entire $60 or $30 credit, the unused portion cannot be refunded. Please note, you cannot participate in the opt-out credit if you are not eligible for the state contribution towards your health insurance premium. This includes COBRA participants, surviving family members, or adjunct faculty members. More information is available on page 12 of the NEBG. Now that you have a better understanding of the different health plan options and the certification and verification processes you need to complete when adding dependents, let's review the available optional add-on benefits. There are two dental plan options. State of Texas Dental Choice Plan is a preferred provider organization or PPO plan that allows you to see any dentist you want, but you'll pay less if you go to a dentist in one of two Delta dental networks. You can use your benefits in the US, Canada, or Mexico if you live in the US. In the Delta Care USA DHMO plan, you must choose a primary care dentist from the list of approved providers, use services within the state of Texas, and use a dentist within Delta's network. Otherwise, services are not covered. View the dental comparison chart on page 25 of the NEBG for information on common covered expenses. State of Texas Vision is the vision insurance plan offered to employees and dependents. With the vision plan, you can get a routine eye exam from an in-network provider for $15. That compares to the $40 copay you would pay for an exam using your Health Selective Texas benefits. The plan has a large network of providers in all 50 states. Each covered participant has a $200 retail allowance per plan year to use on eyeglass frames or contacts from an in-network retailer. Copays vary depending on the type of lenses and extra add-ons you request. You can use your benefits once per plan year. This plan doesn't cover eye injuries or diseases such as glaucoma or cataracts. Care for these types of conditions is covered by your GBP health insurance benefits. For a list of services offered, check out the vision comparison chart on page 26 of your NEBG. Next, let's look at your life insurance options. We'll start with optional term life insurance. As we discussed, full-time employees enrolled in health coverage receive $5,000 of basic group term life insurance at no additional cost. You can purchase additional life insurance coverage by enrolling in optional term life insurance. Only employees can enroll in this coverage. It's not offered to dependents. Premiums are based on your age, salary, and the level of coverage you purchase. 4 coverage levels are available: Election 1, Election 2, Election 3, or Election 4. These correspond with coverage amounts of 1, 2, 3, or 4 times your annual salary. For some elections, you must complete an Evidence of Insurability, or EOI. EOI is an application process through which you provide information on the condition of your health or your dependent's health in order to be considered for certain types of insurance coverage. During the first 31 days of employment, you can enroll in Election 1 or 2 of optional term life insurance without EOI. Elections 3 or 4 always require EOI. After your first month on the job, you can apply through EOI during summer enrollment or with a qualifying life event, or QLE, to enroll in or increase your optional term life insurance. You can initiate the EOI process through your ERS online account or by working with your benefits coordinator. You can choose to receive instructions for completing the EOI application by mail or email. If approved, the coverage will begin on the first of the month following the approval. If you initiate EOI during summer enrollment and get EOI approval prior to September 1st, coverage will begin on September 1st. If you get approval on or after September 1st, coverage starts on the first of the month after the approval date. Each election includes an equal amount of AD&D or double indemnity. This means the coverage doubles up to $400,000 if your death is ruled accidental by a judge. Now let's look at dependent term life insurance. You can choose to enroll eligible dependents in dependent term life insurance. All eligible dependents are covered under one premium as long as each dependent is listed on the policy. There is one set premium per month, regardless of how many dependents you enroll. Each dependent is covered for $5,000. The coverage doubles up to $10,000 if the enrolled dependent's death is ruled an accidental death by a judge. EOI isn't required if you enroll your dependents during your first 31 days of employment or within 31 days of acquiring a new dependent through a qualifying life event, such as a birth, adoption, or marriage. After your first 31 days of employment, EOI is required if you enroll not newly acquired dependents in dependent term life insurance with a QLE or during summer enrollment. You can find more information on page 27 of your New Employee Benefits Guide, or NEBG. Let's look at voluntary AD&D. You can enroll in coverage within the first 31 days of employment with a QLE or during summer enrollment. Voluntary AD&D is additional life insurance that only pays in the event of accidental injury or death. You can enroll as an individual or include family members. Premiums vary based on the amount of coverage you choose. Coverage is available in $5,000 increments starting at $10,000 up to $200,000. EOI is not required at any time. Here are some important things to understand about voluntary AD&D. If you die because of an accidental death, your beneficiaries receive the full benefit amount. You'll receive a percentage of the coverage amount if an eligible family member dies in an accident, if there's an accident and you suffer any covered injury, or if an eligible family member suffers any covered injury. There is no double indemnity with this plan. You can find more information on page 28 of your New Employee Benefits Guide, or NEBG. Millions of working Americans are facing a growing crisis, a lack of adequate disability insurance coverage. Without some kind of income protection, more Americans are experiencing severe financial difficulty if they need to miss work due to illness, injury, or pregnancy. Many U.S. workers don't have enough savings to cover 3 months of living expenses. It's important to be prepared for unforeseen circumstances. If you haven't already, consider the option of enrolling in disability insurance through the Texas Income Protection Plan, or TIP. There are 2 plans available through TIP, short-term disability and long-term disability. Short-term disability features include a 30-day waiting period, covers up to 66% of your monthly salary, capped at $6,600 per month for individuals making more than $10,000 monthly, for a time period of up to 5 months. Recent legislation, SB 22, went into effect on September 1st, 2023. It provides, for the first time, a paid parental leave, or PPL, benefit to certain state employees. This benefit provides up to 40 days of paid leave following the birth of a child by a gestational surrogate, or adoption of a child. It provides 20 days for the birth of a child by an employee's spouse. So what does this mean for GBP members who have elected optional short-term disability benefit under TIP? The PPL benefit and short-term disability benefit will be available to state employees without offset or exclusion in fiscal year 2024. So what does that mean? State employees who are accessing PPL are able to retain their sick leave entitlements and access TIP short-term disability benefits. TIP short-term disability benefits will begin following the 30-day waiting period and pay for the duration of the benefit period, typically 12 days for regular birth and 26 days for cesarean birth. Again, this is only for FY24 and will be subject to change in following plan years. Long-term disability features 180-day waiting period, covers up to 60% of your monthly salary, capped at $6,000 per month for individuals making more than $10,000 monthly, for a period ranging from 12 months to full Social Security retirement age, depending on how old you are at the time of disability. You must use all available sick leave, including extended sick leave pool, and/or donated sick leave, or complete the waiting period, whichever is longer, before the benefit will be paid. Premium amounts vary based on age, salary, and the level of coverage you purchase. This coverage is not available to family members. If you did not enroll during your first 31 days of employment, you will need EOI approval before you can be enrolled. Please note, pre-existing conditions are subject to certain exclusions, and there's a 6 months pre-existing clause. If you've gone to the doctor or you're receiving treatment for a medical condition during the 3-month period prior to the date coverage begins, disability benefits for that specific condition will not be covered for the first 6 months of enrollment. We briefly talked about evidence of insurability, or EOI, when discussing electing life insurance and disability benefits. It's important to know that EOI must be initiated in your ERS online account during your first 31 days of employment, if required, when you have a QLE, or during summer enrollment. Let's talk a little bit more about who to contact if you have to go through the process. If you're electing optional term life insurance and/or dependent term life insurance that requires EOI, you must complete the EOI process through Securian, the program administrator. The evidence of insurability application will be sent to you from Securian, and if you have any questions, you'll need to speak with them directly. If electing disability benefits, you will complete the EOI process through Guardian Life Insurance, the underwriter for TIP. You can contact the Read group to get your questions answered about the EOI process. With the TexFlex Flexible Spending Account program, you can set aside pre-tax money from your paycheck to pay for eligible healthcare or dependent care expenses. Your TexFlex contribution is automatically withdrawn from your paycheck and deposited into your account each month. 3 types of FSAs are available. Maximum contributions vary for each and are set by the IRS. You can enroll in the healthcare FSA to help pay for eligible medical, dental, vision, and prescription drug expenses. You can contribute a minimum of $180 up to $3,050 annually. Even though your contribution is deducted monthly, the entire amount you designate to set aside for the year is available upfront if needed. There are a few different ways to apply your FSA funds to your expenses. All participants receive a TexFlex debit card that you can use to pay for expenses at the time of purchase. You can also pay out of pocket and then upload a claim for reimbursement through the TexFlex website or mobile app. You can also pay out of pocket at the time of the service and submit a claim by fax or mail. Remember to save your receipts. Even if you use the debit card to pay, the purchase may not be automatically verified as an eligible expense. The IRS requires the TexFlex administrator to validate every purchase as an eligible expense. If they're unable to verify the purchase, they will ask you to provide a receipt to confirm the purchase was eligible. You can carry over up to $610 from your TexFlex account from plan year 2024 to plan year 2025. Any amount over $610 will be forfeited after August 31st. You have until December 31st of each year to submit a claim for reimbursement of eligible expenses incurred through August 31st. If you're enrolled in Consumer Directed Health Select, you can use your Health Savings Account, or HSA, to pay for eligible medical expenses. Because of this, you would not be eligible for the TexFlex Healthcare FSA. However, you do have the option of enrolling in a limited purpose FSA. The limited purpose FSA works the same as the healthcare FSA, but you can only use the funds for eligible dental and vision care expenses. Remember, the limited purpose FSA is available only to Consumer Directed Health Select participants. Finally, let's look at the dependent care FSA. This account lets you submit eligible dependent care expenses for children or adults for reimbursement. You can elect to contribute a minimum of $180 up to $5,000 annually per household into the account. Unlike the healthcare FSA, your entire contribution amount is not available up front. Like a checking account, the money must be in the account before you can use it. The Dependent Care FSA is a reimbursement program. You have to receive services and incur the cost before you can file a claim. If you file a claim before you receive services, the claim will be denied and you'll need to resubmit. You can only be reimbursed up to the amount available in your account. If your claim exceeds this amount, you'll be reimbursed for the remaining amount of the claim once money is available in your account. You cannot carry over funds for your Dependent Care FSA. However, if you don't use available funds by the end of the plan year on August 31st, you have a 2.5-month grace period from September 1st through November 15th to use the remaining funds. You will forfeit any funds you don't use by November 15th. December 31st is the last day to submit claims incurred through the end of the grace period. To use your Dependent Care FSA funds, you can upload claims through the TexFlex website or mobile app after incurring the expense. You can also submit a claim form by fax or mail after incurring the expense. See pages 30 and 31 of your NEBG for more information. Your insurance benefits are a valuable part of your compensation. The second important part of your state employee benefits package is your ERS retirement plan. First, let's discuss who is eligible to participate in the ERS retirement plan. Current or previous state of Texas employees working for an agency that participates in the ERS retirement plan may be eligible for ERS retirement benefits once certain criteria are met. State of Texas employees working for a higher education institution that only participates in the GBP but not the ERS retirement plan are typically not eligible for ERS retirement. For these GBP-only participating agencies, ERS manages most of the benefits, including health, dental, life, vision, disability, and flexible spending accounts. However, ERS doesn't manage their retirement contributions, eligibility, and annuity. Retirement benefits for these employees are managed by different state of Texas retirement plans, such as Teacher Retirement System of Texas, or TRS. This includes employees of higher education institutions, except the University of Texas and Texas A&M University systems, Community Supervision and Corrections Department, or CSCD, TRS, Texas Municipal Retirement System, or TMRS, Texas County and District Retirement System, or TCDRS, and Wyndham School District. GBP-only participants will want to contact their retirement system for more information about their contributions and eligibility. ERS has 4 retirement groups based on when employees start work for the state. All 4 groups feature defined benefit or pension retirement benefits, but each group has different retirement eligibility requirements and annuity calculations. If you started after August 31st, 2022, you're in Group 4, unless you worked at a state of Texas agency before and did not withdraw your ERS retirement account after you left. You might hear coworkers talking or giving advice about retirement benefits and eligibility. Keep in mind they might be in a different retirement group than you, and their information may not apply. The best sources for information on your retirement benefits are the ERS website, your ERS online account, the Statement of Retirement Benefits that ERS will send you every year, ERS customer service, and your agency's benefits coordinator. We'll tell you how you can access these ERS resources at the end of the presentation. For now, I'll give you a brief overview of your retirement benefits. As I mentioned earlier, the State of Texas Retirement Plan is a defined benefit plan, commonly known as a pension. This plan pays eligible retirees a set monthly annuity that is calculated using a formula defined by state law. The Texas legislature also determines contribution rates for the plan. For every state agency employee, a percentage is deducted from your pre-tax earnings and deposited into your ERS retirement account each month. This contribution cannot be changed or waived. The state also contributes 10% of its overall payroll to all state employees' retirement. Contributions are deposited into the ERS Retirement Trust Fund, which professionals invest for the long term to achieve reasonable returns at an acceptable level of risk. One of the advantages of a defined benefit plan is that your account never loses value, no matter how ERS's investments perform. This is true even if you stop working for the state, as long as you don't withdraw your ERS retirement account. You become eligible to retire with a lifelong annuity when you have a certain amount of service with the state of Texas and reach a certain age. For example, in Group 4, you can retire when you have at least 5 years of service and either turn 65 or reach the Rule of 80. The Rule of 80 is when your age in years and months plus years and months of state service equal 80. When you reach eligibility and retire, you will get a monthly payment from ERS for the rest of your life, no matter how long you live or how much money was in your account when you retired. Currently, in all groups, if you retire with at least 10 years of state service, you could be eligible for GBP retiree insurance benefits. And in all groups, the longer you wait before retiring, the higher your monthly annuity will be. You cannot take out loans against your ERS retirement account. If you leave state employment, you can request a refund of your retirement contributions, but not the state contributions and any interest earned on the contributions. Be aware that the funds paid out directly to you are taxed, and depending on your age, you could have an additional penalty when you file your taxes the following year. If you withdraw your contributions, you lose your service credit. This means you will not be eligible for the retirement benefit unless you start working at a state agency again and contributing to an ERS retirement account. More information about Group 4 benefits is on page 32 of your NEBG. And you can find specific information about retirement benefits and eligibility for all ERS retirements groups 1, 2, 3, and 4 at ers.texas.gov. This slide applies only to employees who participate in the ERS retirement plan. This does not apply to members who are elected state officials, or ESO. A member of any group can purchase withdrawn service credit. If you're in Group 4, you can apply without purchasing withdrawn service credit to reach retirement eligibility sooner. You can also purchase withdrawn service credit to increase your annuity, but must do so within 24 months by June 1st, 2023, or if hired after June 1st, 2023, within 24 months of that date. If you purchase the service, you'll be paying back the amount you withdrew from your retirement account, which increases your cash balance and your annuity. If you're in groups 1, 2, or 3, you can purchase withdrawn service to reach eligibility sooner and increase your annuity. If you're in groups 1, 2, or 3, you can purchase the following types of service credit to potentially increase the amount of your annuity or retire sooner: military service credit, waiting period service credit, and additional service credit. In most cases, the earlier you purchase service credit, the less it will cost you. If you're considering purchase service credit or would like to learn more about it, there are several resources available. You can view the service purchase presentation on ERS's website. To get an estimate of how much it will cost to purchase your service credit, you can call ERS or visit the ERS website and search Service Purchase Request for active employees. You can boost your retirement savings through the Texas Saver 401k 457 program, a voluntary retirement savings program administered by Empower Retirement. Financial advisors suggest the average person needs 80% of their pre-retirement income to maintain their lifestyle in retirement. Your ERS annuity alone may not provide the income you need. Think of your retirement as a three-legged stool. One leg is your monthly ERS annuity, the second leg is your Social Security Administration benefits, and the third leg is a personal savings or retirement account, like a 401k or 457. All three legs are needed. Because it's so important to save for retirement, new state employees are automatically enrolled in the Texas Saver 401k plan. 1% of your salary is set aside pre-tax in this savings account. You can increase, decrease, or stop contributions at any time and change how your funds are invested. You can transfer money from a qualified retirement account from a previous employer to maximize your savings with Texas Saver. Please note, program availability may differ for some higher education institutions. Higher education employees may enroll in the 457 plan if their higher education institution offers the plan. To learn more about managing your Texas Saver account, you can view one of the presentations available through the Texas Saver website or contact Empower directly at 800-634-5091. More information is available on page 35 of your NEBG. While you don't necessarily need to designate your beneficiaries within your first month of employment, it's important to do so as soon as you can. If you're participating in the retirement plan, once you've made your first contribution, log into your ERS online account and begin the process to designate your beneficiaries. You can log into your ERS online account to begin the process to designate your life insurance, including basic term life insurance beneficiaries, once the coverage is effective. You'll need to create a profile for your beneficiary. This requires their legal name, social security number, date of birth, and mailing address. Beneficiary designation for your ERS retirement account and life insurance is a multi-step process that requires you to sign and mail back documentation. Your beneficiary designation for each program isn't complete until you print, sign, and mail back the form. To designate beneficiaries for your Texas Saver account, you'll need to download a form from the Empower Retirement website and return the form to Empower. You can update your beneficiary or beneficiaries at any time as needed. Consider updating your beneficiaries if you marry, divorce, and/or have children. Here's something you'll want to check out. All state employees have access to the Discount Purchase Program. Shop online and buy products and services such as computers, appliances, vacation packages, and more at discounted prices. Visit https://ers.savings.beneplace.com/home and click on the Active Employee button. There's no enrollment period or membership fee. Just start shopping and save. This program includes a simple registration step. Just enter your email address and create a password. You'll receive a confirmation email to complete your registration. We've covered a lot of information today, and we want you to know that there are plenty of resources available to you. If you need help enrolling in coverage, contact your agency benefits coordinator. If you work for an HHS agency, you'll contact the HHS Employee Service Center at 888-894-4747. That includes Health and Human Services employees of DFPS, DSHS, HHSC, Cancer Prevention and Research Institute of Texas. You can log into your ERS online account and enroll yourself and your dependents in coverage and designate your beneficiaries. You can also contact ERS toll-free at 877-275-4377. We're open Monday through Friday, 8 a.m. to 5 p.m. Central Time. Check out our Facebook page and YouTube channels for information about your benefits. Visit ers.texas.gov to find information about your benefits, contact information for benefit plans, and plan administrators, and to access your ERS online account. Thank you for taking the time to learn more about your benefits as a state agency or higher education institution employee.